Hi, I'm Sue from Quinton Foot Clinic in the wee village of Diganway. So I'm wondering, are you prioritizing your feet? And we get a lot of people who don't. We go to the dentist regularly when we're lucky enough to be able to see one. We even get our nails done in the beauticians. We get all sorts done, but our feet seem to come last until they become bothersome, and then we remember them, and then usually there's a bit of a waiting list. But we need them because they're what take us where we need them to go. A lot of my older people, some of them have excellent feet, in brilliant condition because they've taken care of them all their lives. They just can't reach them. But I tell you what, taking care of them throughout your life really pays off when we get older, believe me. And I've really learnt that lesson from some of my older guys. So are you prioritizing your feet? And to be honest, I mean, we're right in the summer, and yes, I can get them summer ready, but usually I want to get them summer ready in the winter. That It's usually a bit too late now for me to make them as nice as I would love to make them for you, where you've got the sandals on and you just want them to look nice and healthy. So the top tip of that one is book in the winter, and we can get them summer ready in the future. So a lot of people ask me, well, how often should I come and see someone like you? Well, it depends on all sorts of things, and usually it's how much access you've got to your feet. I know mine are starting to get a bit further and further away. I'm not quite as agile as I used to be, just in cutting them. I usually say 6 to 8 weeks for certain people, but for those of you that can reach your feet, I am more than happy to show you how to look after them than pay me silly money every 6 to 8 weeks for me to do them. Some people come for the pure pamper of it, and that's their choice. But I will always give you advice on what it is you can do to take care of your feet well. And that's in trimming them. And some people I've had wives come in and showing them how to trim their husband's toenails. And that works. I have no objection to that, so that at least they're getting it right, because I would much rather train you to cut them right, so that hubby, or even husbands that do wives, don't get ingrowing toenails or don't come into any painful complications. So yeah, so I'll always give you good advice on that as well. So yeah, ingrowing toenails you do not want. There's all sorts of advice I can give you about taking care of your feet at home. So like this time of year, dried, cracked feet are enormous. I'm getting so many calls off people. Can you sort out my heels, please? They are in agony, they're bleeding, they're cracked. And there really is so much you can do yourself to prevent that even happening. We're not educated about our feet, and they're basically really, really thirsty, and they just need a lot of moisturizing. And if you've got hard skin, cracked feet, I personally, to get you going, will take off a lot of the hard skin with my scalpel. That doesn't hurt, by the way. There's no nerves in dead skin. So yeah, I cut those cracks out, and again, that doesn't hurt. And I'll show you, they get a nice foot file, and then I'll show you the right creams to use. And the creams are really, really important, because for me, the skin on the feet is different to the skin on the body. So if you're just using ordinary body moisturizer, it won't cut it. The feet take so much pounding. They're a lot thicker. The skin is a lot thicker, needs a lot more intense moisturizer. So I always recommend a good urea-based heel balm, especially for cracked feet. But I'll be talking more about that as the weeks go on. I'm going to talk about different subjects. I deal with corns, which are painful, little intense bits of hard skin caused by pressure, and they can really be painful. And again, I can show you how to help prevent them. Sometimes it's the way you walk and the shoes that you're wearing that are the cause. So I will investigate that, give you advice. And again, if there's any subjects that you would like me to discuss in the next few weeks, then pop something down below, pop a subject down below, and I will talk to you about that and how to treat it as best as I can. Quite often you'd probably need to come and see me, or someone like me, for some treatment initially to get you started, and then there's some things you can do at home. So my favourite one being fungal nail treatment. That really is my baby. If I spot any fungus in anybody's toes, I am right in there treating it, because it's another infection in the body that we don't need. And that always starts with athlete's foot, and most people don't even know that they've got athlete's foot. The amount of people present to me with very dry looking skin, but actually it's athlete's foot. Again, I'll give you the advice on what treatments you need to treat yourself, and give you advice on and information on how to treat fungal nails. It's all a bit of an education, and quite often, if you've got fungal nails, particularly depending on how bad it is, you'd need to see me every couple of months or so for a while, and then and then we'll take it from there. So yeah, so don't be afraid to contact me about anything. I'll do my best to give you advice, but really, when people do message me and say, oh, I've got this, I've got that, really, I do need to see you for a full assessment. I need to take a medical history down. That's really important. When I'm treating feet, I can't just administer anything. I need to know what's going on in your background. Have you got diabetes? Diabetics, I am passionate about taking care of your feet because of all the neuropathy and the dangers that go with that. My mum had to have her leg removed because of diabetes, and I'm absolutely passionate about taking care of your feet when you've got diabetes. And my vascular patients, if you've got heart problems, again, it can make a difference as well to your feet. So if you've got any questions or any particular subjects you would really like me to home in on over the next few weeks, just pop a comment in down there, and I'll do my best to answer it. So thank you very much, and I'll look forward to seeing you every week and giving you some advice on some particular topic, feet related. Okay, thank you. Bye.